And let's begin. First thing I want to talk about today is coronary heart disease and atherosclerosis. Everybody see this? We're good?
Yep, all good.
Yeah.
All right, here we go. All right. What is atherosclerosis and what is coronary heart disease? Well, the definition of arteriosclerosis is a disease of the arteries characterized by thickening, loss of elasticity, and calcification of arterial walls. It results in decreased blood flow, particularly to the brain and the lower extremities. So it's common in the carotid arteries and in the aorta, and also common in the coronary arteries, which again are branches of the aorta. It develops because of aging. It's a normal process. You can also get it if you have high blood pressure or hypertension, and also another risk factor is diabetes. What did you guys learn from the blood system? What starts a clot? I'm asking that as a question.
Platelets?
Bingo. Platelets. Platelets. So if there is an irritation to an artery caused by diabetes, caused by high blood pressure, caused by aging, caused by other factors, you will have platelets aggregate on the endothelium of that artery. And then calcium comes. Remember, calcium is a mineral important in clotting. So all of that starts with platelets. That's very important to understand. Here is what your normal coronary arteries should look like. Nice lumen. A nice lumen. Here is your coronary artery. Here it is. A branch of the aorta. A diseased coronary artery will have plaque in it. Platelets, cholesterol, triglycerides, calcium, and other debris. And this will significantly lower the amount of blood that goes through the artery. And then you have an entire blocked artery. When you have an entire blocked artery, obviously this area of the heart is not getting any blood, and this is called a myocardial infarction. All right, myocardial infarction. When there is this much damage and you're still getting some blood, you can still have problems with the heart. If your heart rate goes up while you exercise and you're not getting enough blood to the heart, you will get what's called ischemia. And that will give you symptoms of chest pain. So there's gradual narrowing due to arteriosclerosis. Here you see again partially occluded, and here you see almost 100% occlusion. And what happens is you get restricted blood flow. So let's talk about coronary heart disease. 7 million Americans are affected every year. It's caused by a narrowing of the coronary arteries. It is the number one killer of men and women in the United States. Greater than 500,000 people die each year from coronary artery disease. Number one killer, but not the number one cardiovascular disease. The most common cardiovascular disease is high blood pressure. And you're going to have a lecture on that on the 9th of March by one of the students, okay? 60 million Americans have some form of cardiovascular disease, including high blood pressure, coronary artery disease, coronary heart disease, congestive heart failure, myocardial infarction, or other forms of coronary vascular disease. Almost 3,000 Americans die each day from coronary vascular disease. That's one death every 33 seconds. It costs a lot of money. It costs a lot of money. Risk factors. There are many, many risk factors when it comes to coronary vascular disease. High blood pressure, high blood cholesterol, smoking, obesity, physical inactivity, diabetes, and stress. These risk factors are all controllable. You can lower your blood pressure, you can lower your cholesterol, you can quit smoking, you can lose weight, you can exercise, you can treat diabetes, and you can lessen your stress. The other risk factors are uncontrollable. Whether you're male or female makes a difference in coronary vascular disease. And we'll talk about gender in a few minutes. And also genetics. And as you get older, everybody has some degree of coronary artery disease. But the big three, all controllable risk factors, are hypertension, high cholesterol, and cigarette smoking. All three increase the risk factor by 8. So if you have all three of these, the risk factor is 24 times as great as a normal person who doesn't have these risk factors. And we should also add lack of exercise. That's number 4. If you look at this graph, here's hypertension, here's cholesterol, here's smoking, and look, here's inactivity, right here. Inactivity. Very common in the United States to be inactive. Hypertension. You're going to have a lecture on high blood pressure in a week. It's commonly called high blood pressure, and you know about the systolic and diastolic measurements. The normal systolic is basically between 110 and 130, and the normal diastolic is basically between 70 and 90. What are the symptoms of coronary heart disease? Well, the first symptom is what we call angina or chest pain. when there's narrowing of the arteries and you're getting very little blood supply to the coronary arteries supplying the heart muscle, when you exercise, you increase your heart rate. As you know from the formula, cardiac output is equal to stroke volume times heart rate. When you increase your heart rate, you increase your cardiac output. So you increase your demand on the heart. If you have a 70% narrowing of one of the coronary arteries and you raise your heart rate up to 110, 120, and you have blockage, you're going to have chest pain. You're going to have shortness of breath. You're going to have heaviness, tightness, burning, pressure, and squeezing in your chest. It may radiate to your neck. It may radiate to your jaw, and it may radiate down your left arm. Not everybody has chest pain. They may just be short of breath or have fatigue. What are the consequences? Well, there's lack of oxygen due to lack of blood supply, and that lack of blood supply is ischemia. Remember, the coronary arteries supply your heart muscle with blood. It is due to narrowing of the coronary arteries. The heart responds by giving you chest pain. And finally, you have a heart attack, or what's called a myocardial infarction. Local ischemia, usually due to a thrombus or an embolus in your coronary artery. And if not treated immediately, can lead to permanent heart damage. So how do we diagnose coronary heart disease? We diagnose it by electrocardiogram. We diagnose it by a stress test. We diagnose it by nuclear scanning, and we diagnose it by coronary angiography. How do we treat it? Well, you have risk factors. You need to get rid of those risk factors. You need to change your lifestyle. You need to quit eating high cholesterol foods. You need to lower your blood pressure. You may need to take medication. And you may have to have surgery. So what do? Well, we change our habits. We exercise more. We decrease our diet in fat. We lose weight. We increase our exercise. And God, please, we stop smoking. We stop smoking. I'll talk to you a little bit about smoking. It's probably one of the worst habits known to man. It's very costly. I don't know what the price of cigarettes are today, but I assume it's probably over $6 a pack for 20 cigarettes. Okay, let me tell you a real fact about cigarettes. If a pack of cigarettes was to be allowed to have the amount of money needed to treat heart disease caused by those cigarettes, a pack of cigarettes would cost $31 a pack. Okay? That's how expensive it is to smoke. As you get older, you can see here the numbers rise. As you get older, everyone develops atherosclerosis. Atherosclerosis. So that's important to understand. It is a process of aging, a process of aging. And you can see the difference in men and women. Okay? Look at the difference. huge numbers in white men, huge numbers in white women. Okay? This is simply coronary artery disease. If this was high blood pressure, this would all be reversed. There would be blacks up top and whites down below. But this is coronary artery disease. Okay? More common in whites than in any other ethnicity. So, how do we treat coronary heart disease? Well, we can use beta blockers to lower heart rate. We can use nitroglycerin. What does nitroglycerin do? Nitroglycerin enlarges and vasodilates arteries. We can also use calcium channel blockers, and we can use aspirin. Anybody know what aspirin does in the treatment of coronary artery disease?
Isn't it a blood thinner?
It is. It's a blood thinner. And how does it thin the blood? What did you learn in the blood system? What does aspirin affect? What part of the blood system does aspirin affect?
It makes the platelets less, like, I don't know the
What?
exact word for it.
Sticky. The word is sticky. Less sticky. Okay? So aspirin is a blood thinner, and it's used to make the platelets not adhere to the vessel wall. So that's how aspirin works. Remember, I told you if you're going to have surgery and you are on aspirin, you need to stop taking the aspirin for 7 days, because what's the lifespan of a platelet? The lifespan of a platelet is 7 days. So all of those platelets, while you're taking aspirin, are less sticky. If you stop taking the aspirin for a week, then your platelets are now sticky and will clot. And that's always good after you have surgery. You want to clot. Okay? And you can also use cholesterol lowering agents. Another medicine is ACE inhibitors. ACE inhibitors. I want to remind you all, I will never ask you to give me the name of a drug unless it is a vitamin, a mineral, aspirin, or a non-steroidal anti-inflammatory agent, or a medicine that is derived from a natural product inside the body. What did you learn about ACE? Angiotensin converting enzyme. This enzyme is in your lungs, and it converts angiotensin 1 into angiotensin 2. Angiotensin 2 is the strongest raiser of blood pressure in your body. If you inhibit this enzyme, your blood pressure drops. This is the basis of 85% of all treatments for high blood pressure. ACE inhibitors. So this could be a question on exam number 2. All right? That's important. I'm not going to ask you these because these are not common things. These are not common things. Just know you need to lower your cholesterol. And that high cholesterol is a risk factor in coronary artery disease. Surgery. There are many types of surgery. The most common today is a stent insertion. Okay? Let's say you're having a heart attack, which means that there's no blood flow to a part of your heart. You come into the emergency room, we diagnose you as having a heart attack. We call the cardiac guys. The cardiac guys come, grab you, take you to the cath lab, stick a catheter into your femoral or brachial artery, and they go into your coronary arteries. They find out where the blockage is, and they put a stent in. They enlarge your coronary artery so blood flow comes through. Okay? So blood flow comes through. This is the most common treatment today of someone who is having a heart attack. The second most common is coronary artery bypass. If the cardiologists go in and try to put a stent in and realize that there's more than one stent needed, they will schedule you for a coronary artery bypass. This is the abbreviation. It's called CABG, CABG, coronary artery bypass graft. All right? And this is what the graft looks like. They attach a vein to the aorta and bypass the block. Here's the blockage, and they bypass the blockage. They put a vein in the aorta, and they put a vein distal to the blockage, bypassing the blockage. This is known as a CABG, coronary artery bypass graft. Coronary artery disease is more common in men. However, women have a higher mortality rate. Okay? And the reason women have a higher mortality rate is because usually they're older and they're sicker when they have a heart attack. And unfortunately, women are treated less aggressively than men. And women don't recognize their symptoms in a timely fashion. So it's more common in men, but higher mortality in women. Higher mortality in women. If you are young, say you're 22 years old and you have a heart attack, what do you think the most common reason for a 22-year-old male is to have a heart attack?
Out of breath.
Genetics.
You're out of breath, but that's not a reason for your heart
Obesity.
attack. Say it?
Obesity.
No, that's one. That's one.
Genetics.
Two.
Smoking.
Three. You haven't given me the top reason yet.
Inactivity.
Four.
High blood pressure.
Five.
Would your diet be considered there?
Say it again.
Your diet?
Six. Give me the top reason.
Pre-existing health conditions.
Seven. Give me the top reason.
Did we say smoking already?
It doesn't matter. I'll say eight. Go ahead. That's still not the top reason. What do you think the top reason for a 22-year-old male to have a heart attack is? You're in college. You go to parties.
Oh, drinking.
No, not drinking.
Drugs.
There you go.
There we
There
go.
you go. Drugs.
Drugs.
What kind of drugs?
Cocaine.
Bingo. That's one of them. What else?
Weed.
Weed actually is not a cause of heart attacks. We have
Heroin.
cocaine. What else?
Heroin.
Heroin is not a cause. Heroin's not a cause. What is
Ecstasy?
going to, say it again?
Ecstasy?
Ecstasy. Bingo. Bingo. Ecstasy.
Like
Speed. Okay? All of those are causes of young people with heart attacks. So if I was in the emergency department and a 22-year-old guy came into the emergency department complaining of chest pain, and I diagnosed him to have a heart attack, I would do a drug screen on him. And I would find, for the most part, drugs. Okay? And the big ones are, you mentioned them, cocaine, speed, ecstasy, MDMA. There's hundreds of them, but anything that's going to raise their heart rate. When you raise your heart rate, the formula is CO equals SV times HR. You now have more cardiac output than you need. Everybody understand that?
Yes.
Good.
Does it happen often?
Well, I would say once a month, maybe. I mean, it's not that often. It's usually once a month. You know, I mean, most emergency departments see a heart attack every day. Okay, literally every day. So once a month is rare. All right. Okay, so that's what's important. That's what's important. All right. Again, women die more than men, but men have heart attacks more than women. Okay? Smoking. It's a bad habit. Trust me, if you smoke, you're in trouble. You should quit smoking. All right? We define a heavy smoker as a pack or a pack and a half a day. This is a pack or a pack and a half a day. This is a $10 habit. Here it is, $10 habit. And it is not only expensive to smoke, it's expensive to have a heart attack. Cigarettes contain hundreds of compounds. The most harmful are tar, nicotine, and carbon monoxide. Carbon monoxide. The tar is basically carcinogenic. The nicotine releases epinephrine and norepinephrine, thereby increasing your heart rate, increasing your blood pressure, increasing your cardiac output, increasing the contractility of your heart, increasing oxygen consumption, and increasing coronary artery blood flow. Okay? So that's important to understand. Carbon monoxide is never good. It causes constriction of blood vessels. Not only does it have these three horrible things in cigarettes, but it also has cyanide in it. Okay, so it's horrible to smoke. I still can't believe we actually legalized cigarettes. I just can't believe it. Okay, and now in New Jersey, we've legalized marijuana.
Would you prefer to have marijuana or cigarettes
Say it
legalized?
again. Say it again.
Would you prefer to have marijuana or cigarettes legalized?
I'm not really sure. When you talk about smoking, you have to talk about marijuana. Marijuana may be beneficial, but it also causes lung disease too. Marijuana causes lung disease. You're getting a foreign substance into your lungs. It may not cause heart disease, but it certainly will cause lung disease. Okay, so that's important.
What about vapes?
Just as bad as smoking. Just as bad. Has all that nasty stuff in it, just as bad as smoking. Not much different. Not much difference.
And there's not much research done about it either.
Well, there's going to be soon. So don't, I would not vape if I were you, but I don't understand that anyway, but that's all right. Okay. Not only does smoking contribute to atherosclerosis, it also lowers HDL. Remember I told you HDL, happy, it actually stands for high density lipoproteins, but the H stands for happy because HDL is good cholesterol, where LDL, lousy or low density lipoproteins, is bad cholesterol. So if you lower the levels of good cholesterol, you raise the levels of bad cholesterol. When you lower the levels of HDL, it causes a decrease in the elasticity of your vessels and is responsible for 20% of all deaths from heart disease, lowering HDL. And this is why female smokers have a higher risk than male smokers, because it lowers their HDL. All right? Here is the risk of death in coronary artery disease from smoking. Okay? Look at the risk if you've never smoked. Look how low it is. Look how low it is. Okay? As you get older, all of this rises. Okay? And then look at people that smoke over a pack a day. It's huge, huge. So smoking is very relevant when it comes to coronary artery disease and death. All right? Stress. We live in a society where there's stress every day. You're stressed right now. You're in college. You have a stressful life. You have to manage your grades with your work and with your social life. Okay? So there are multiple problems when it comes to stress, anxiety, neurosis, dissatisfaction with life. Life changes. What happens if someone dies in your family? It's a lot of stress. So stress is certainly involved in coronary heart disease. Okay? Oh, I'm not going to talk to you about the Framingham study. That's not important. But I will talk to you about cholesterol. If you have type O blood, you have a lower cholesterol. And you know that a higher cholesterol contributes to a higher rate of coronary artery disease. There is also a ratio between good cholesterol and bad cholesterol. If this ratio points towards high density lipoproteins, good cholesterol, it's very important. If it goes to lower density lipoproteins, it's very bad. So the ratio is important, HDL to LDL. Okay? High density lipoproteins seem to have a protective effect against atherosclerosis. Women, by definition, have a higher concentration of HDL than men, probably because of estrogen. It is the most important of all lipid risk factors, the amount of HDL you have in your body. If your HDL is below 35, you have an 8 times incidence of coronary artery disease to those with a number of 65. Moderate alcohol intake may have a positive effect. This is a dynamic study that was done in France about people drinking wine. We realized that the French have a lower incidence of heart attacks because they drink wine, red wine, every single day. Okay? Now, you're going to have a lecture on the benefits of alcohol, pros and cons, when it's a group presentation, if I remember correctly. Okay? So I won't talk much more about resveratrol and alcohol intake. Exercise has a positive effect because it allows your heart to build anastomoses, to bypass areas of the heart that have plaque in them. And obviously, the more you weigh has a negative effect. So obesity is one of the bad effects on your heart. All right? What about diet? Well, you need to reduce your saturated fats. You need to increase your polyunsaturated fats. You need to have more protein than fat. And you need to count calories so you can also lose weight. Any questions on coronary heart disease or atherosclerosis?
I have a question, Professor.
Go.
So you were talking about how like alcohol could have a positive effect. Is that
Yeah.
because of like the antioxidants in the grapes that make up the wine, or is it actually the alcohol itself?
No, it's the grapes. It's the antioxidant in grapes. I don't want to dwell on that because you're going to have a lecture on that in a week. Okay.
Okay.
But that's a good question, though. All right.
Thank you.
Anything else before we take the UFC off the air here?
How much of cigarettes are natural?
Say it again.
Like, what percent of like cigarettes would you say are like tobacco, like actually tobacco products?
I would say probably 75%.
Is just like the natural tobacco and the rest like the carcinogens added in, like the tar, this, all that.
Yeah. Yeah. Exactly. Yeah. Yeah.
Okay.
All right.
Thank you.
Okay. Let us continue. Okay. I wanted to review the heart. So let's review the heart. Here you see heart anatomy, pathway of blood, heart conduction, cardiac cycle, which we really didn't talk about, so I'm going to skip the cardiac cycle, and cardiac output and control. So let's start picking on people. Samuel, cardiac muscle tissue is found in which layer of the heart?
Ooh wee. Hmm.
Listen, look. You ready for this?
Yes, sir.
What does muscle start with?
Like the word? It starts with an M.
Okay, good. Now give me the answer.
There we go. Myocardium.
Done.
Appreciate that, Professor.
All right. This valve is, oh, I'm sorry. It's Lindsay. You here? Ramsha?
Yes.
Oh, good. You're up. Okay.
Yeah.
This valve is found between the right atrium and the right ventricle.
Is it the tricuspid?
Correct.
Uh,
Very good. Ariana,
Yes, I'm here.
you don't sound so happy. Which blood vessels leave the heart and transport blood to the lungs?
um, I'm not sure. I'm just gonna guess.
Oh, don't guess. Don't guess. Why would you guess?
um,
All right, let me ask you this question, Ariana. What part of the heart, right or left, gives blood to the lungs?
right?
Yes, right. Okay. So that's important. Now, Michael will tell you the answer to this question. Which blood vessels leave the heart and transport blood to the lungs?
Isn't it the pulmonary arteries?
Got it?
Yes, thank you.
Ariana,
Yes.
tell me what type of blood is in the pulmonary arteries. Is it deoxygenated blood or oxygenated blood?
Deoxygenated?
Correct. Deoxygenated blood. You are correct. Pulmonary artery is one of the only arteries in your body that carries deoxygenated blood. The majority of arteries in your body carry oxygenated blood. Okay?
Okay.
Good. Jessica.
Hello.
Hello. These structures prevent prolapse of the AV valves.
Is it C?
I don't even know what C is. Let me ask you this question. How do the AV valves differ from the semilunar valves? You can say, I don't know.
I'm not sure.
I'll have Joseph tell you. Joseph, tell me the difference between AV valves and semilunar valves.
One, the semi-lunar, they prevent back.
I can barely hear you. I don't know why. Can you turn up your mic?
The semi-lunar valves, they prevent the backflow from the arteries into the ventricles.
True, true. Let me ask this question to both of you, Joe and Jessica. Out of these four choices, which is the Latin words for heart strings?
Would it be the first one?
Yes, it'll be the first one. You are correct. It is the first one. The chordae tendineae will close the AV valves to prevent prolapse. Jessica, Joe, you understand that?
Yes.
Yes.
Okay. All right. Isaiah?
What's good?
Oh, I didn't ask that. I'm not skip this question, Isaiah. I'll give you another one.
Okay.
Okay, here you go. Blood is carried to the heart by these vessels.
Is it arteries?
No. carried to the heart by these vessels? Arteries carry blood away from the heart.
Veins.
The answer is veins. Now, Erica,
Hi, how are you?
I'm good. You'll tell us what three veins carry blood back to the right atrium.
Isn't it the inferior and supravena cava?
That's two of them.
Oh, okay. And then pulmonary?
No, it's the coronary sinus.
Oh, okay.
Okay? The coronary sinus, the IVC, and the SVC. All right? Okay. Maddie?
Hello, sorry if you hear a dog barking in the background.
That's okay. I love dogs. Of the following, which is the best definition of arteries?
Carry blood away from the heart.
Carry blood away from the heart. Boom. Bingo.
Cool.
Brianna.
Professor,
Yeah.
my microphone wasn't like unclicking when you called on my name, so now it's working. So you can call on my name whenever now.
That's Lindsay, right?
Yes.
All right, here. I'll give you the next one. Okay. Blood being pumped out of the left ventricle enters.
Is it the aorta?
It is. Okay. Very good.
Thank you.
All right. Brianna. Spencer.
Yep, I'm here.
Blood is prevented from flowing back into the left ventricle by the
Is it the aortic semilunar valve?
It is. Okay, very well done. Very well done. That's a hard question, actually. It's the way it's worded is a bizarre thing. Linnea.
I'm here.
Okay. Deoxygenated blood from the myocardium enters the right atrium through the
Is it B?
No, it can't be B because it's deoxygenated blood. Okay. It is the coronary sinus. Remember, these are the what are the three veins that bring deoxygenated blood back to the right atrium? It is the IVC from the inferior vena cava, which drains the lower half of the body, the superior vena cava, which drains the upper half of the body, and the coronary sinus, which drains the heart. Okay, got it?
Yeah.
Melanie?
Hello.
Hello. Without SA node input, what would the heart rate be?
About 50 beats per minute.
That is correct. You're not going to get away so easy. Here's the second part of this question. Without the SA node, what pacemaker is beating at 50 beats per minute?
You got me there, Professor.
The AV node, okay? Remember the progression of electrical impulses. SA node to AV node, okay? Latricia.
Hello.
Hello. Oh, you don't sound so happy either. Here you go. Come on.
Depending on what you ask me.
The bundle of his is located here.
Okay. Oh man. I'm trying to think. I'm trying to picture it.
Okay, no problem. Take your time. We got a lot of time.
No. Is it? No. I'm stuck. Okay, I'm just gonna go for it. Is it C?
No, it's actually B. It's in the inner
Oh,
ventricular
that's what I
septum.
thought. Okay.
Okay? All
That's
right?
what I thought.
All right.
All right. Thank you.
Dwayne.
Yes, I'm here.
All right. Oh, we didn't really talk about this. It's atrial repol. Don't worry about it. I'm not going to ask you atrial repolarization. But what if I asked you this question? All right. Atrial depolarization occurs during this period seen on an ECG. So instead of repolarization, I put a D instead of the R, atrial depolarization.
Sorry, I'm trying to picture the ECGs that we went over.
No problem. No problem. Take your time. Let me make this easier for everybody. Dwayne, tell me what is the first part of the heart that will beat to put blood into the rest of the heart? Is it the atria or the ventricle that beats first?
The atria.
The atria. Okay? So when the atria depolarizes, it means that it's actively beating. So what signifies the atrial contraction and depolarization? Which wave? What is the first wave of a ECG?
Isn't it the T wave?
No, it's the P. No, the T wave is the last wave.
Oh, okay.
T wave is the first. Okay. Remember, I changed this, so this is obviously not the right answer. It's P wave for depolarization. All right, everybody understand that? Hannah.
Yes.
Here we go. Oh, you won't know this. Don't worry about this. Not important. All right.
Okay.
Nerve impulses are directly supplied to the papillary muscles by the what? You have to know where the papillary muscles are. Do you know where the papillary muscles are?
No.
Do you know what the papillary muscles are?
Aren't
You can say no.
No.
The papillary muscles are the muscles that control the chordae tendineae of the AV valves. They are on the ventricles. Okay? So now the question is, nerve impulses are directly supplied to the ventricle by what?
AV node?
No, the AV node is in between the atria and the ventricle. Which one of these choices is only in the ventricle itself? Oh, here. Let me ask you this question. Hannah, let me ask you this question.
Okay.
Where's the SA node? What's the A stand for?
It's in the right atrium.
It's in the right atrium. Okay. Where's the AV node?
The bundle of his.
No, the AV node is between the atria and the ventricle. The bundle of his is in the interventricular septum. The only one of these choices that are in the ventricle are the Purkinje fibers. Okay, everybody understand that? Hannah, you understand it?
Yes.
Okay,
Yep.
all right. Dennis.
Yeah.
Oh, we really didn't talk about this, but the lub-dub heart sounds heard during auscultation of the heart are really associated with closure of the valves. Don't worry, I'll give you that answer. Okay, but I'll give you another question. Ooh, the cardiac cycle I'm not going to talk about. But I will talk about cardiac output. All right, Dennis. The amount of blood pumped out of each ventricle in 1 minute is called?
B.
Boom, cardiac output. Good. Carly.
Hello.
Hello. I didn't talk about this. Don't worry about that. That's not important. Neither is this one. But this is important. All right, Carly. The parasympathetic nervous system decreases heart rate by how do you slow someone's heart rate? Let's look at it. Let's look. We didn't talk about it that much, but I want you to understand. Does releasing norepinephrine decrease someone's heart rate?
No.
No. Does opening sodium gates decreases someone's heart rate? This is known as depolarization. Does that decrease your heart rate?
No.
No. If I close the sodium gates, would that decrease heart rate?
No.
No. So the only answer is opening potassium gates. And you can remember that because I told you I could kill you in an instant if I injected you with potassium. Remember, okay? Please don't kill your friends, all right? Okay.
Professor, I have a question.
Yes, go.
So I know like bananas are really big in potassium.
Yes.
So like how many bananas would it take to see an effect like that?
To slow your heart rate?
Yeah.
Probably a whole tree.
Okay.
Yeah, you couldn't do it. You couldn't do it. If that was the case, monkeys would have a slow heart rate, and they don't. Okay? Preet.
Hi.
Oh, you don't sound happy either. Sound happy. Sound happy. No, you're not. We didn't talk about this. We didn't talk about this either. Oh, I think you're lucky here. You're only lucky because we're going to go into something else. Okay, you ready? Let's see what we got. We got another one. Okay. Preet, these are the smallest blood vessels in our body.
Is it B?
No, it's capillaries. It's capillaries. This is where gas exchange is. Capillaries. Okay? Sarah.
Hello.
Hello. Another happy soul. Come on, smile. Let's go. This is the muscular area of blood vessels.
I have no idea.
Yes, you do. Stop. Yes, you do. Hey, look. What does muscular start with? What letter?
Oh, is it the tunica media?
See, this is really simple. It's really simple. Does that make sense?
Yeah.
Okay. All right. Emma.
Hi.
Hello. Oh, at least you sound happy. Good. Venules unite to form
Veins.
veins. Kennedy.
Hello.
Hello. Another happy soul. All of the following are found in large arteries, except
Valves.
valves. Where are valves found?
Are you still asking me?
Yeah. Sorry, Kennedy.
Oh, you're good. I know, like,
If they're not found in arteries, what are they found in?
veins.
Veins. Boom. Okay. Got it?
Yep.
You could have said the heart too. I would have said yes.
Yeah,
You
I
are
was.
correct.
I wasn't know.
I
If
know. I
veins
know what
was
you were
part of
thinking. I could
Yeah.
feel it. I could feel it. Well, that would have been right though, right?
Okay.
Okay. Mary Kate.
Hey, Professor.
Hello. Which of the following is not a type of capillary?
I'm gonna say A.
No. Fenestrated, sinusoidal, and continuous are all capillaries. There is no such thing as a distributing capillary. Okay. Nicole.
Hi.
Hello. These vessels carry blood towards the heart.
Is it? Ooh, is it the? This is probably wrong. Is it the arteries? Or is it the cap? Oh no. Okay.
It's veins. It's veins. Okay.
Oh.
Remember.
Okay.
You got it. All right.
Yeah, I understand now.
Okay. All right. Gianna.
Hi, Professor.
Hello. The exchange between blood vessels and cells occur here.
B, capillaries.
Capillaries. Well done. Anthony.
Hey, Professor.
Hello. These vessels control blood flow to the tissues.
Is that muscular arteries?
Too big. Give me something smaller.
Arterioles?
All right. Arterioles. You understand that?
Yeah, I got it.
All right. Melissa. Melissa's not here. Samuel.
Yes, sir.
Sinusoids are a highly modified form of these vessels.
Yikes. Um, I'm not sure if I know how to say this. Capillary. Yeah, struggling with that word. How you say it?
Okay, that's correct answer though. That's correct answer. No problem.
Well, how you say it?
Huh?
I was asking, how do you say the word?
Capillaries.
Capillaries. There we go.
Capillaries. Capillaries. All right. Gianna.
Yes.
Oh, you sound happy. Here we go.
I'm very happy.
Excellent. You should be. These vessels serve as blood reservoirs.
Oh. Um. All of the above?
No.
Oh.
Tell me where 64% of all your blood is at all times. Remember the pie graph, the big blue pie graph. Do you remember the story of someone in shock whose blood pressure was 80/20? And when the EMTs got there, they elevated their legs. Where is all that blood?
I don't know.
It's in the veins. All right?
Okay.
Okay.
The answer-
Lindsay.
I'm sorry. Never mind.
What happened, Sam?
I was gonna hold my question for later, but the answer is in the veins.
It is veins.
The story that you told us about the lifting of the legs. What was the reason that the blood was all in the legs again?
Because the majority of your blood is in your lower leg veins.
Okay.
Okay, so if you can increase if you can increase the capacity of blood going back to the heart, you're going to increase your blood pressure. So by gravity, that venous blood will get into the right atrium and through the inferior vena cava and raise your cardiac output. Make sense?
Yes, sir. Is that because of like the muscles in your lower half of your body, also like in your legs? Is that the reason why there's more blood there?
Yes. Yes. You know, over 60% of your weight is below your belly button.
Yeah.
Okay. In most people.
All right.
All right. Lindsay.
Yes, I'm here.
Oh, good. Okay. If you have a blood pressure of 120/80 millimeters of mercury, what is your diastolic pressure?
Is it 80?
It better be. Okay. Okay. The next question is stupid. So I remember the next question is dumb. This is a dumb question. So, okay. Wow. Ramsha, here's a hard one.
Yes, sorry.
That's okay. Here's a hard one. Blood flow is inversely proportional to.
I'm not sure. I'm gonna guess. Is it peripheral resistance?
You guessed correct.
Oh wow.
Good for you. Good for you. All right.
Wait, why is that though?
Because what is peripheral resistance? It is the resistance to flow. So if your diameter of your blood vessel is restricted, you have more resistance to get blood out of that artery. That makes sense?
Yeah, that does. Thank you.
Okay, so it's F/P. Flow is inversely proportional. I'm sorry, R to R. F/R. Flow is inversely proportional to resistance. All right? Got it?
Yeah, thank you.
Okay. Ariana.
Hello.
Hello. Which of the following blood vessels have the greatest effect on peripheral resistance? Don't answer it. We didn't talk about it. It's hard. That's a very stupid question. It's arterioles. Don't worry about that. I'll give you another one, okay?
Okay.
Gaining weight may increase blood pressure because increased adipose tissue causes an increase in
A.
No, definitely not A. Definitely not A. Let's say you weigh 400 pounds. I don't want to give you a lot of weight. You weigh 400 pounds. What happens to your blood vessels? They have to supply blood to now 400 pounds.
So
What happens to your blood vessels? Do they get longer or shorter?
longer. So B.
They get longer. So the answer is
B.
B. Okay? Got it?
Yes.
Michael.
How are we doing, Professor?
Very well. Wow. This part of the nervous system is responsible for vasomotor tone. What part of the nervous system maintains your normal blood pressure?
Is that both sympathetic and parasympathetic?
No, they don't act together. They act separately. And the one that maintains your tone is the sympathetic system. All right?
Gotcha, Professor.
Jessica.
Yes.
Baroreceptors in our arteries respond to This is not an easy question.
Is it D?
Let's see. That's what I thought.
Okay.
It's just your blood pressure because baro means pressure. Okay.
Okay, thank you.
Joseph.
I'm here.
I know. Which of the following does not modify the cardiovascular center activity?
The thermoreceptors.
Can barely hear you.
Sorry, the thermoreceptors.
That is correct. That is correct. I won't let you get off too easy. Joe, where is the cardiovascular center?
I don't know.
Yes, you do. Tell me the part of the brain that is strictly involuntary. Did you take AP1?
I did, but I'm not
But
sure.
you didn't learn anything. I'm joking. It's the medulla. It's the medulla. Okay?
Okay.
All right. I'm just picking on you. Isaiah.
Hello.
Hello.
It's good.
Oh dear God. No, you won't know. This is stupid. This is stupid.
Yeah.
Oh, this is an important question though. The renin-angiotensin mechanism stimulates the release of which hormone from the adrenal cortex?
Is it B?
It is B. You are correct. Aldosterone. That is correct. Now,
Thank you.
Erica, I'm going to ask you another question before I show this answer. Erica, you there?
Hi, I'm here.
Tell me, out of these 4 hormones, which is the only one that lowers blood pressure?
Honestly, I'm not really sure. My guess is it A?
No.
Okay.
So Maddie may help you. Maddie, you there?
Yeah, I am. But
Same question.
C.
Maybe Brianna can help. Brianna? Maybe you're not there. Spencer?
I'm here.
Which of these 4 hormones lowers blood pressure?
Is it C?
Well, you all picked the wrong one. The answer is D, ANP. I'll tell you right now, ADH comes from the posterior pituitary and raises blood pressure by keeping water and salt in the blood. Aldosterone comes from the adrenal cortex and keeps salt and water in the body. Norepinephrine comes from the adrenal medulla and directly increases your blood pressure. ANP, atrial natriuretic peptide, comes from the atria and is the only hormone, one of the only hormones in your body that lowers your blood pressure. All right? But the answer to this question was aldosterone. Linnea.
Hi.
Hello. Which of the following is not a branch off of the arch of the aorta?
B.
You are correct. B. Remember, I told you I wanted you to know the 3 branches of the arch of the aorta: the left common carotid, the brachiocephalic, and the left subclavian. Okay? Very well done. Melanie. Latricia.
Hello.
Hello, hello.
All right, where we
The
at?
first portion of the aorta is called
Oh, the first quarter. I don't know. First portion.
this is right before the arch, right before the arch. What happens is this. Let me just try and show you in your mind what we're talking about, okay? The blood from the left atrium goes through the aortic valve into this part of the aorta, into the arch, into the 3 branches, into the systemic circulation. What is the part of the aorta before the arch?
Is it the descending or aorta?
No, it's the ascending aorta. It rises first. Okay? Ascending means it rises. Okay? What happens is it comes out of the heart, through the aortic valve, into the ascending aorta, into the arch of the aorta, down to the thoracic aorta, and then down to the descending aorta. Okay?
And that's what I was looking at down. That's why I said descended. I was thinking about it going down.
No, I understand.
Okay.
Dwayne.
Okay.
Yes.
Wow. In which of the following tissues would low oxygen levels cause vasoconstriction? This is an interesting question. I wouldn't expect you to know the answer, but I want you to understand the question. I am giving one of these organs very low blood flow. It's getting very low oxygen. Which of these following tissues would low oxygen levels cause vasoconstriction? When you get low oxygen levels in this tissue, it shuts off parts of its tissue. You're actually going to learn this next week. This is an early one. You probably don't know the answer to this. Take a guess. You only have two choices. Let me give you this. Do you think the heart would shut off part of its muscle?
No.
No. You think the brain would shut off part of its lobes?
No.
No. You could pick this. But the answer is right here. The answer is lungs. That's the answer. Okay. So in that case, Dwayne, I'll give you another question. All right.
Okay.
These arteries supply 80% of the cerebrum.
B, C.
Wait a minute. What did you just say? B? You just said two answers.
I said, would it be C? Sorry.
Oh, no. It would be B.
Oh.
The externals supply the face and skull. The internals supply the brain. Okay?
Got it.
Hannah.
Hello.
Hello. Oh, I told you not to worry about these. Don't worry about them. I'm not going to ask you any questions on them. Wait a minute. No. You lucked out, Hannah. You lucked out. All right, let me stop recording.